We're going to start just a couple minutes early. We have a lot of stuff on the agenda today, including a training, yes, no extra charge on maybe. So we're going to have a crab feed related training. So for all of you who sort of said, I haven't been able to get my continuing credits in Rotary, this will count toward that. It's like, what? There's a requirement for continuing credits? No, there's not. All right, let's start with the Pledge of Allegiance. And Glenn, would you lead us in the Pledge of Allegiance?
I would, President Mark. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, songsters, where are they? Wow, we are plugged in. I feel like, what happened here? We used to be acoustic, and now. And is this sort of a Dylan kind of a thing? When Dylan yeah, that's what they do with Dylan. Remember when that happened? It was not pretty. Okay, here we go. She was dancing herself already. All by myself.
Well, since we're having a presentation that talks about health care in the Tri-Valley, we thought we'd do Good Love.
That's related how?
Because it says doctor.
Oh, got it.
Okay. 1, 2, 3. Good love. Good love. Good love. Good love. I was feeling so bad. I asked my family doctor just what I had. I said, doctor, Mr. MD, doctor, can you tell me what's ailing me, doctor? He said, yeah. You see, all I really need, good love. Good love, all I need is love, good love. All I want is love, good love.
All right, they get 3/4 credit for beginning at the same time and ending at the same time. So that's like a C+ already. So well done. Okay, thought for the day, Anita. There you go. Have you been in one of these meetings before? Do you know what comes next? All right.
Okay. Well, today is another day from the Dollies. The first one is from the Dalai Lama. Oh, by the way, welcome. Dalai Lama. People take different roads seeking fulfillment and happiness. Just because they're not on your road doesn't mean they've gotten lost. And Dolly Parton. Don't get so busy making a living that you forget to make a life.
We don't do this all by ourselves. We have people who do this. So on our front line, we've got Linda. Linda, where are you? There you are. She's taking notes, so if you don't want something recorded, don't do something noteworthy. All right, Spur Publishers, Ted Michaels. Where are you, Ted?
I'm right here.
Right there, there's Ted, okay. Photographer Don, he's been up here getting our best sides. Audiovisual Dennis. Our greeter was Michelle. Michelle, did everyone get greeted by Michelle? Hey, all right, well done. Nicely done. Did you get all the boxes filled in that were appropriate to fill in? Very good. All right. If you did not get greeted by Michelle or don't think you've been marked as here, you should get yourself marked, as they say. All right. We do not have those anymore at the far end of the left, which seems odd to have something that's not there on the slideshow. Maybe next time we won't have that. All right, moving on to the next. We have Trex and Bob, but we have half. So we have a sergeant at arms. Arm? Is it singular then?
I don't know.
It's hard to say. These multiple plurals are always difficult. Bob will be back with us. Web Miraculous. Wow. Almost divine in nature there. All right, Kathy.
You're very special.
There we go, very special. Callie helping us with public outreach, and Niall running the video camera. Is the video camera on, Niall?
It is.
Yay, all right. We'll find some way to put that someplace where you can all find it. We're working on all these things. Real-time solutions. Introductions of visiting Rotarians and guests. First, do we have any visiting Rotarians? No, we do not. Do we have any guests, with the exception of our speaker today? Okay, I saw a hand go up. If you're a guest and the person next to him, stand up. All right, you're going to give us an introduction, sir.
I'd like to introduce Merlin Martin. This is actually his 4th visit. He's indicated he would like to become a member of
Yeah! Now, do you know anybody who can help you with the paperwork on all that?
I think I can do that.
Wow, that's fantastic. Do we have any other guests in the room? We have somebody still playing with their guitar. No, that's okay. That's all right. Again, stating, well, actually, there's a few, but they're just not connected to us, so they're not nice. Moving right along. Announcements. We have announcements here. All righty. Okay, so you remember that we participated in the beard growing contest, or what was called the Rooms of Hope. You'll also remember that we raised $5,918. Yay! That will go to make life just a little more bearable for kids who are going through a very rough time. You'll also remember that we raised more money than anyone else. Yay! And I am reminding you, because of that, Brooke Witherspoon and her lovely husband have invited us to celebrate at the Ale House tonight, okay, at 5 o'clock to 6 o'clock, okay? So they'll give us some things to munch on, maybe even a drink if we're particularly well behaved. If you want other things, you can buy them. They're actually like a bar. It's amazing. They have all sorts of alcohol there, so that you won't lack for that. And you can stay longer than 6. They'll just stop handing out the free stuff at that particular time. So you are well. So about how many people are thinking they might show up to get a free drink and some hors d'oeuvres and sort of we've got 40-ish. Oh yeah, come on out.
Oh, there we go.
Yeah, and if you want to bring your spouse, that's okay too. But we do appreciate certainly everyone's contributions to that. We did something very good collectively there. So come on out and celebrate tonight. Birthdays and anniversaries, Dave and Tree, you are up.
I'm so sorry. I'm right in your way.
Wait. Let me have my hair. I learned that from you. Yeah. Okay, so we're going to start with birthdays. And Lance and I were talking, it must have been a very cold March or something, because January's got a lot of birthdays. First one, Jeremy Young, January 1st.
Wow. That's our really sweet answer.
Oh, okay. Beth Wilson, January 6th. Loretta Caskey, January 8th. Is that today?
Yes.
It is.
That's why she's not here. Yeah. Bob Bishop, not here, January 11th. Lance, January 11th. I figured I didn't need to say his last name. There's only one. Tim Berry, also not here, January 14th. Carol Howell, January 18th. JR, January 19th.
All right, JR.
And Ronnie Forbes, January 27th.
All right.
Okay.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Rotarian. Happy birthday to you.
Anniversaries. Okay, we have 2 anniversaries, but these people are married, so does it count as one?
Yeah, they get to double dip.
Okay, well, Pat and Kathy Coyle, today is their anniversary. 28 years. You're only going to get 1 rose unless this next person's not here, then I'll give you both.
Oh, thank you.
The next one is Hank Shea and Ernie. January 1st, not here? All right, then both the Coyles get a rose.
Oh, wow.
My sunshine, my only sunshine, you make me happy when skies are gray. You never know, dear, how much I love you. Please don't take my sunshine away. Good job, guys.
Who gets married in January? Brr. Was it fun? Okay. Well, maybe it was because of a very specific thing. You know, well, you probably got a break on the hall because they weren't 6 deep in January. All right, crab feed sign up. So we've got Bob and Courtney, and we're going to walk through. Bob doing an introduction and an overview of major goals and properties here for the crab feed. He said he'll do that in 40 seconds. And then we're going to walk through the new system here because we're actually leaving the 1800s, which is what most of our stuff was based on, and we're going to see if we can teach Rotarians how to use the system. And our belief is that if Rotarians can learn, that the general public will have no trouble. Sort of anybody can learn how to do this. Now, if you can't, it's too bad because the decision's been made, we're going with this, so this isn't really like a participatory thing in that way. It's just we're trying to help you along. So with that, Bob, take it away.
Okay, well, it is officially crab season. And that means it's officially crab feed season. And as Mark said, we're going to have kind of a whole new way of at least buying things. We're going to try to be totally cashless this year. And we hope that'll melt some credit cards at the actual crab feed. So to do that, we're enlisting a company called Paybe, which Courtney's going to explain. And she's going to, as Mark said, she's going to walk you through. So each crab feed meeting, I'm going to stand up and I'm going to try and tell you something more about the crab feed, mainly trying to get you to give me something for the crab feed. But today, Courtney is the teacher.
Okay.
Turn one of them off.
Oh, thank you. Bob said that we got together as a group and did a lot of planning for the crab feed. And there were 2 things that we looked at closely, which is how to make it easier to order a ticket and get to the crab feed, and how to make it easier to check in. On top of that, how do we manage our money a little bit more effectively so we get the money into the bank quickly? So we did Paybe. We looked and found a company called Paybe. Let's see if up. Still not, okay. That's our crab feed, okay. Paybe. They are a fundraising solutions. They only work with nonprofits, and they work with in-event galas and online. They do a lot of things, but we are going to specialize and take the capacities of this software platform and only do a couple of things for the first time. One is to order your ticket online with your credit card. Now, last year, most people used their credit card to buy a ticket. So all we're doing is adding the online aspect of it. And the other is, once you get your ticket for this event, we will be using a ticket for you to come in. So we're just scanning tickets like we're going to the movies or to the banquet or anything like that. Just so you get a little bit better understanding of Paybe, here are some people who use it. There are multiple Rotary clubs who are already using Paybe for their events. And locally, Open Heart Kitchen and Museum on Main. We spent time talking to them, how they liked it, did it work, was it effective, and everyone gave us very good feedback as far as the system itself, the effectiveness of it, and how easy it was to use. Okay, so now, how does this work? The easiest thing for us to do right now is to go to our website, livermore-rotary.org. And on the website, as of today, you will see, if you scroll down on the front page, this section here, which is about the crab feed. And right here, at the bottom, you're going to be pushing a button. Pretty simple. This is the first thing you'll see when you push that button. Pretty much like ordering anything else online. You are going to get an individual ticket or you're going to get a table for 8. And that individual ticket is either 1 or 7. You'll notice that the price is $85. On February 1st, we are raising the price to $90 to encourage everybody to buy their ticket in January. Oops, I need to go back. Okay. Like any online order, the next thing you'll see is who are you, what's your email, what's your phone number. This is for the person who would be buying the ticket. The next thing is, if you had a table for 8, you're going to be adding your guests. One of the most important things that we're going to be asking you to do this year is to list all the names of the guests, their email, and their phone number. Because, for 2 reasons. One, we're going to be doing a lot of communication about the crab feed over the next couple of months, and check-in procedures. And since this is a new way of doing things, we just thought we would be over-communicating as much as we could. The other is, you are going to be receiving your ticket electronically. So everyone will get a ticket, and that's why we need the emails. After you finish signing up, giving them your credit card, you will get 2 emails. One is your ticket. That's what it will look like. And we will ask you to bring that ticket to the event, and we will scan it as you come in. You will also notice that you will be able to add attendees. So for example, if you did not put all the names in for your guests at a table for 8 because you didn't have them or you were thinking about it or whatever else you want to do, then you push this button on your electronic ticket and it'll take you back to the place where you can add in those names. You will also get an email that says, thank you for your donation, and here's your credit card receipt. So the only thing that's a little bit different here is that you will see fees covered. We are requesting that you pay a credit card fee, and in this case it's $2.40, and that money will go back to Rotary to support our programs. So we'll make a little bit of extra money in that respect. So things to remember. I mean, this is it. Prices go up on February 1st to $90 a person, so please, if you can, make your order in January. Complete all the sections of the order form to receive your ticket. Most importantly, the email and the phone number, if you want chicken, yes. And then and seat assignments if you're at single tables, and a list of all your guests if you have a table for 8. So we know that change and technology are sometimes daunting and challenging. So we have a customer support section. As usual, Debbie Peck is the person you call for any questions or issues, or you just want to talk, you need help, whatever. It's the same thing as it's always been. And then if indeed she's not available, or you happen to see either Ted or I, we'll be glad to answer any questions you have. And I'd like to just say, let's see, do I have, no, this is it, help is available. A little more help. At the end of this, we don't have a whole lot of time for questions today, so at the end of the meeting, Debbie's going to sit back for a while. We'll be here for a little while to answer any questions. Tomorrow, an email will go out to everybody in the club that here's the crab feed, here's the pricing, and you can click on the URL to order your ticket. You can also download the crab feed poster that you all have on your desk, and if you're really techie, you can scan the QR code and order on your phone. But I'd like to thank you all. This is something new for Rotary. We think it's going to make a big improvement on the ordering, the check-in, and the managing of the money. And I know it's a change, so we appreciate your support very, very much.
We have time for
2 or 3 questions, yes.
I know there's a lot of people that attend that are not Rotarians, so how are we marketing outside of the club?
Well, with the poster, for one, it'll be up around the organization. But Debbie, help me and tell me if I'm wrong here. A lot of the people who come.
People are already contacting me that are outside of Rotary, so I'm working with them, and I have a lot of their emails that I'm sending them to, so they'll be contacting.
And that's why we want it by raising the price February 1st. If we're all sold out, we won't advertise.
Right.
So then otherwise we'll put some ads in the paper, that kind of thing, which we've done in the past.
One more.
I just have a quick question. You said about a table for 8.
Yes.
Does that mean that the credit card that goes in is paying for all 8?
Yes.
Yes.
So if you don't want to pay for all 8, but you've got 8 people, then they give the extra tickets?
Well, have
and
them
then
Venmo you and then you pay, so we're not collecting money from, yeah, have them pay you and then swipe it.
Oh, we'll do one bonus question from you, because of the anniversary.
You get the bonus question.
My bonus question is how many tickets are available?
335, is that about right?
No, it's an even number.
Don't wait till spring.
Yeah.
There's, 42 tables. 8 times 42. Which I can't do.
We have had some orders already for about 33 people, because we needed to test the system to make sure it was functioning correctly, and we got all the bugs out of it, which we are pretty confident that that's the case now. So we'll have plenty more.
What if I have a table, I need mine. Can I put mine in the 8?
Talk to Debbie about that.
All right.
Again, thank you so much.
So we have an entire system set up, the entire RLCC. Everything's laid out to the T's. Permits are being turned into the city of Livermore. Emergency response is being coordinated. And one person needs 9 at a table. There's always one, who sort of says, I understand the rules are here for a purpose, but they're for other people. So I I bet we could make that work there. Alrighty, so I would encourage you guys to go on and get your tickets early. That way, if it doesn't work, it didn't do what you wanted it to do, there's plenty of time. You're not scrambling at the end. You're not having that disappointed thing of, what? The tickets are gone because it's January 30th and everybody bought their tickets. So soon, early. Just like I tell my students, it's school, turn it in early. There's no downside of getting your tickets early. So very much appreciate it. This is going to be fun and exciting, and actually will make things on game day a lot smoother. So we're looking forward to that. And I have been sort of in on the emails for the crab team. Lots of people working really hard. And certainly Bob's going to ask you, but I'm going to ask you right now to start thinking about this, which is things that you can give to be auctioned off. Big things like, your timeshare week somewhere, or small things as well. So all of those things, that's what makes this thing work. It's not just the chowing down on the crab, which is great fun, or chicken. Why would you come to a crab feed and have chicken? That's my question. But there's always somebody. So there we go. There we go. They're allergic to crab or shellfish. So yeah, there we go. So that's funny, Mom. All right. So thank you. Isn't that funny? I don't know, that strikes me as particularly bizarre. As the guy in charge of the crab feed.
He's in charge of the crab feed.
He gets chicken. He goes, I wouldn't eat that stuff. I know where that came from.
Are we going to have crab this year?
Bob, are we going to have crab?
I think so.
Yeah, we're basing it on that belief. All right, so next week, we've got Steve McCoy Thompson, the Gratitude Network, a great presentation. I invite you all back here. Of course, we're right back here at the RLCC next week. And this week, we've got Mary Grace Umia. Mary Grace, you want to wander up?
I love
And
that name.
who's doing our introduction for Mary Grace here? Pat, is that you? Pat, well, have you wander up while the both of you kind of come on up here.
The nun. Mary Grace. Sounds like a nun.
Yay, all right, thank you.
Oh, yeah.
So we are pleased to welcome back to our Rotary Club Mary Grace Gumula. Mary Grace is a communications and public relations leader with over 15 years of experience in web development, event planning, brand strategy, and creative direction. As Director of Communications and Community Engagement at Access Community Health, Mary Grace drives strategic communications and stakeholder engagement while advancing the mission of making healthcare accessible and affordable for all. Her work focuses on building meaningful partnerships with local organizations and coordinating community health initiatives, and expanding Access's impact on the Tri-Valley region. Her commitment to community service extends through her roles as board director at Tri-Valley Nonprofit Alliance, where she supports nonprofit networking, and education initiatives as board director and fundraising chair for the Royal Theatre Academy. The Royal Theatre Academy is a family musical theater and performance arts program for ages 5 and up. I've never heard about this before, but it looks like it's going to be an interesting part of her presentation. She works to strengthen community connections and create collaborative opportunities that benefit the broader Tri-Valley area. So thank you, Mary Grace, for speaking to us once again. Welcome back.
Hello, everyone. Thank you so much for having me. It's really wonderful to be here and to see so many familiar faces. As you heard in Patrick's intro of me, I am involved in quite a few things. I'll be focusing on talking about Access today because that's my day job. But like he said, I'm also on the board for Tri-Valley Nonprofit Alliance and on the board for World Community Academy. You're welcome to ask me about any of those things afterwards. So let's start this presentation. So, Access has been around for over 50 years. We opened our first location in 1972, started off as a grassroots effort to provide pediatric care to low-income children. And then we had adult health services and our WIC location open, and our WIC location on Santa Rita Road in Pleasanton is still operating. We opened our first site in Livermore in 1981. We were granted our federally qualified health center status in 2009, and I'm really proud to report that our most recent audit, which happens for every single community health center, we got an A+ on that one, so that's really good news.
That's great.
Our mission is to provide quality, affordable, accessible, and compassionate healthcare services that promote the well-being of all members of the community. And you know, everybody who works at Access truly believes this. It's one of the reasons why I love working at Access. At Access, we believe in whole person care, which means we take care of the whole person mentally, with your medical, dental. We offer acupuncture and chiropractic services too, and I'll talk about it a little bit later, but we also have initiatives and partnerships with other local organizations to take care of people, help with financial insecurities, food insecurities. I'll talk more about that later. But in 2012, we introduced our integrated behavioral health services, which basically means that after you have a regular medical appointment, if you are exhibiting or have any concerns about mental health issues, after that appointment, they can walk you over to talk to a therapist or schedule you for your next appointment. So the behavioral health aspect is integrated into your medical care. In 2019, we opened our first dental site in Dublin, and in 2020, we introduced chiropractic and acupuncture services, and that was literally right before the pandemic. So, with our opening of our new clinic, we have grown to over 200 employees, which is truly amazing. And this includes support staff and our physicians, nurse practitioners, our nurses. It is so wonderful seeing how much Access has grown in the 5 years that I've been there. So every year we do something called a UDS report where we have a lot of the data. Our team takes all this data and we kind of put it into a snapshot. This information is typically shared in our impact report or our gratitude report. And it's from 2023 and we will soon have our information for 2024. But it's just a really good insight into what Access does in the community. So in 2023 alone, provided 125,000 healthcare visits to over 14,000 patients. Out of that, 54,000 were medical visits, 19,000 were behavioral health visits, 14,000 were WIC, and I'm not going to read the whole thing, but I'm happy to share this information later too. This is a snapshot of where our patients live. Their income, the type of insurance, the majority of the insurance that our patients have is Medi-Cal, their top diagnoses, and our ages and ethnicities. Like I said, I won't go over all of this. One thing that I know we didn't talk about last time we were here was our community engagement efforts, and that really ramped up between 2023 and 2024. And I'm really proud to have led that and to work with organizations like City Serve, Open Heart Kitchen, Tri-Valley Haven, and the Tri-Valley Nonprofit Alliance into making sure that our patients are receiving true whole person health. And that's what I was talking about earlier. So here in Livermore, we have our Livermore Connects Coalition. So we attend community events all together, and our patients and our client base is very similar, so we all keep connected in that sense. Our partnerships are very strong. So every week, Access has a community engagement manager over at Vineyard 2.0 Resource Center. So we're there to help engage with their community and to strengthen the trust so that they know that we're here for them. Sometimes it's slow, sometimes it's really busy, but what really matters is that we're meeting them where they're at and we're there answering their questions when they need it. In 2024 alone, we held 96 informational tables and events, and it's more than 3,900. I have the number here. It's 4,575 attendees that we interacted with in all of these events. So now we have 6 locations. So this is our main headquarters, 5925 West Las Positas Boulevard. It's our largest clinic so far. And then we have our original our Livermore clinic over at 3311 Pacific Avenue. Railroad is one of our original locations. And then we have our dental office over in Dublin. Here's an image of our WIC office. And on January 6th, our Livermore location at 1686 2nd Street opened to patients. So it's been a very exciting and a very tiring week for everybody at Access. It is a beautiful site. So at this clinic, our capacity is to serve 18,000 total visits a year, and 9,000 of those being medical visits, 8,600 being dental visits, and 22 of those being mental health visits. Here's a layout of the site. And what's really exciting about it is this is our first hub. So at this location, we are doing mental health, dental services, excuse me, acupuncture and chiropractic, and enrollment services on top of medical. Here's some images of it. It's beautiful in there. I know that some of you might have seen what it originally looked like when it was the tax office right here. And so it was almost a gut renovation. I was walking through the dental bays, and I kind of felt like I was in a spaceship. Everything is so clean and new and just beautiful. They did a really great job designing it so that it's accessible for our patients. And then they have a wonderful experience, even when going to the dentist. We have this beautiful skylight, so I like taking advantage of that. Some other highlights I wanted to go over. We have our Access Bridge program, which is our urgent care. We provide urgent care mental health program. We provide in-person and virtual services for all individuals and families dealing with mental health concerns. And this is for ages 5 and up, for everybody in the Tri-Valley. Access has taken really innovative approaches and implementing telehealth services to improve patient care. And another exciting development is that we've opened our Age Well program, which is running out of our Railroad location. This is for our advanced age community, where we're focusing on designing comprehensive and personalized healthcare for them. Because this is one of our fastest growing populations. It grew 21%. But yeah, sorry, I'm losing my voice a little bit. Does anyone have any questions for me?
Right behind you.
Thanks, Mary Grace. Just can you explain a little bit more about the Bridge program and how that works? Because I think it's so excellent.
Thank you. Yeah, so like I said, our Access Bridge program is available even if you're not an Access patient. It's available to all residents of Dublin, Livermore, and Pleasanton, ages 5 and up. So typically what they'll do, if somebody is in crisis, they call our line, and they'll talk to one of our care coordinators that will help them through the process. They'll help de-escalate the situation, and then they'll help them through the mental health system to help establish them with long-term care. And you know, we really hope that our community takes advantage of this, because especially during the holidays when things get really stressful, especially with you know, teenagers in high school when they're going through really stressful moments. This program has been really instrumental in decreasing the amount of 5150s that we've had in our area. We partner with Stanford Healthcare, and so what they do is if they do have a situation going on in the emergency room, they connect with us so that we can take in that patient and you know, help de-escalate the situation.
This was very interesting. I'm happy to see the pictures of it all done and looking beautiful. Is it possible to come and just walk in and take a look around?
Yeah, you can email me. We can arrange for that. Yeah.
Okay, but that wasn't my question.
Okay.
That was a comment. My question is, I very briefly saw the slide about insurance, and I looked at, you had Medicare, Medi-Cal, and so how many people would be completely uninsured? And if and does the number of visits from Medicare or Medicaid change very much from year to year?
Could you put that slide back up? It was like
Sure.
6th or 7th slide, I think.
I didn't get a really good look at it. That's
Yeah,
why I
me
was
neither.
asking.
Let me get to that slide for us.
Yeah.
I don't have that number. However, there are shifts going on in the health insurance space. So I don't really have an answer to that. I apologize.
But there's some private insurance and then...
Yes, and Access does have sliding scale fee.
Okay.
Yeah, so you know, we don't turn anybody away.
Okay.
So it says there that there's no insurance for 17%.
Right.
So that means that they make just a little bit too much to qualify for the programs, but aren't insured elsewhere.
Yeah.
Yes, and our enrollment team, because there are so many changes and it is such a complex system, our enrollment team is trained to help everybody through that process.
Other questions?
Years ago, I had to last minute get, like, I think it was like a TB test or something to haul the kids for a field trip. And do you still do that kind of thing there? Because, I mean, obviously I had insurance, but my doctor couldn't help me out. It was on a Tuesday, and I had to have that shot by Friday for the field trip. So is that something you folks still do, that kind of thing, or no?
We have it listed that we do it. It's typically by appointment still, because they want to make sure that you have all the documentation necessary for us to safely give you those shots.
Right, okay. Yeah, I was just wondering because it was, I was scheduled to drive and they didn't tell me until Tuesday, like, oh, you gotta have a TB test. What?
Don't you hate when they do that to you? These schools.
Yeah, exactly. Anybody else? Oh.
Yeah, right here. Thank you, Mary. So I'm going to add, hopefully, a little context. About 10, 12 years ago, I was on the committee to help raise the funds for the Pleasanton facility, the new one that's on Las
Positas, yeah.
But more importantly, the last several years, I've been one of the 9 trustees of the Alameda Health System. Did anybody know what the Alameda Health System is?
No.
All right, so let me give you a little context here, and it's why it's important to understand what Access does for us and for the folks that live here. So the Alameda Health System, every county by law is required to provide healthcare, basic healthcare, to every resident. So no matter who you are, you get basic healthcare. The Alameda Health System, which you probably know, Highland Hospital, right? Highland Hospital is the only level 3 trauma hospital in the East Bay. So it serves Alameda and Contra Costa County. So, well, my wife, who's an RN, will tell you, if you're shot, you want to go to Highland, for reasons you probably are aware. But
It's
other
not
places
their
like
first gunshot.
Stanford and Vancouver and all other places are great. But, so we operate 6 hospitals. We just took over St. Rose and Hayward because it was going to go under. And that means Hayward was going to, basically, patients were going to have to go to our other hospitals. Or to Washington, which is in Fremont, or, now you might wonder, what about Tri-Valley? Alameda Health does not serve, for the most part, does not serve the Tri-Valley. That's where Access fits in. So it's funded to some extent by the county, by the federal government, but it's to serve the population in the Tri-Valley that the county is required to serve but can't because Alameda Health System is not about to build a facility in the Tri-Valley, but Access is here and has been here for decades, and it serves a level of, provides a level of service that is much underappreciated. Because if you go to the other side of the hill, you will, and if any of you do want to come with me to Highland, or because that's where our board meetings are, or show you one of our facilities, I'll show you. But what the professionalism is great throughout the county, but what Access does is incredible, and you really should take the time if you feel like I'm happy to take you on a tour of any of our hospitals. But if you're here, go visit some of the facilities at Access.
Yes, contact me. I'll take you on a tour too.
Sorry to do your job for you.
No, thank you.
Hi, thanks Mary Grace for being here. This is great, and thanks Glenn for emphasizing how important Access Community Health is. You mentioned partnership with Stanford Healthcare. Is there additional partnership with Stanford Healthcare or with other similar healthcare organizations in the region?
Well, in terms of partnership, organizations like Sutter and Stanford help fund our Access Bridge program. There are other things in the pipeline with larger health organizations. But one of the other things that we've been working on with workforce development is we've launched an externship with Carrington College, and a lot of it is making people enthused about wanting to work in healthcare and community health in general. It is our workforce, there's a workforce shortage, it's very chronic. So by having this externship, it's creating pipelines for people to work in. I've even been at schools and I've talked to the kids to let them know what community health centers are and the type of roles that you can take, emphasizing it's a really wonderful place to start your career in healthcare. And that they were not aware of before. So that was also very fulfilling talking. Hi, hello.
Hi. Having worked a little in homeless shelters, I know getting back and forth, transportation to the facilities is important. Do you have anything like free bus passes and Uber passes and things like that?
So we will organize Lyft rides for patients who need it. It also kind of depends on their health insurance. For example, if they have Alameda Alliance, they have programs that their patients can sign up for ride shares.
Okay, go ahead, Bob.
Looking at this chart, I'm trying to figure out what percentage of the, say for example, Livermore population is under the 200% poverty level.
I don't have that number off the top of my head. However, what I can tell you is that it's our largest patient population. That's why we do so much work, especially in the 94550 and 94551 area. And it's a large reason why we opened our clinic over here in downtown Livermore.
When you're done, I have one too.
Thank you, Mary Grace, for your presentation. And I'm just going to add something that she glossed or said about the A+ rating for the recent federal review and audit. So I am the proud board chair for Access Community Health. So I had the privilege to be sit in on those results of the auditors. It's an extremely thorough audit. This is much beyond if anybody's ever been involved with federal audits at any levels. Maybe some of you from the lab know how that is, and all of the paperwork that has to be completed and the quality of work that has to be done. To get 100% score is a big deal. And I think it's a big deal, and it's a testimony to the quality of the staff at Access Community Health. And one of the things that I've been most impressed with is the continual looking on process improvement, and whether that's wait times for patients when they call or anything, and all that's an ongoing, continuing process for Access Community Health. And we should be very proud that as Rotarians, we have been supporters throughout the years for allowing Access to get to the point where it is.
Thank you.
Splin may have answered this question, but and it could be that I wasn't listening.
No way.
That way. The question that I had, so I'm assuming you have resources, because if you've got a huge population in Livermore, let's say, that's below the 200% poverty level, and there's homeless, et cetera, is there an organization that kind of goes out there and sees these people, and if they've got like, you know, chronic rotten tooth or whatever, do they help get them in? Or if they've got some mental, is there some connection to help these people help themselves, I guess is my question, because I know there's a lot of them that they don't want help, and I don't know, that's a whole other story in my book, but is there some connection that helps you help them?
Yeah, sure. So I'll touch on a couple things. So Bay Area Community Health has the contract for the homeless mobile units. So we actually work really closely with them so that those patients have continuity of care as soon as they're seen. And a lot of that work is done over at Vineyard 2.0. So like I said, we have a community engagement manager there every week, and sometimes we're just there, you know, to be someone to talk to be a familiar face. And then on Tuesdays, we have an enrollment person there. So ideally, the situation would be is that they go to Helen, who's our community engagement manager, and they talk to her. She's able to look in their chart to see if they need anything in there, or if they have any messages from their patients, because oftentimes they're not going to look at their messages. Or if they're not already established patients, she'll schedule an enrollment appointment with Jocelyn, who is there every Tuesday. And then that way we can get them established in care appointment, and they can be seen for, you know, whatever their ailment is. So, you know, being able to be on site there. We're also on site at Cornerstone Fellowship, and even at our community events that we go to. People are able to come up to us and say, hey, I think I need help with this. I'm not an access patient yet. And Helen will be able to schedule them for an establishing care appointment, or an enrollment appointment, yes.
Thank you. You can tell the room is full of supporters of Access, and I'm certainly one of the biggest of those. You're just an incredible asset to the community. So what I wanted to ask is, you know, there's a lot of people that support you and have resources. If you could wave a magic wand, what are some of the key things that you need right now to help deepen and expand the impact that you're already having in our community? We partnered with you on an autoclave in Kathy's year. We've partnered with you to deliver a number of small medical devices to some of your clients during the COVID pandemic and so on. Is there something like that where we could help you?
We're working on all of that stuff. Like, it's something that I oversee, and I would love to expand upon it. Somebody was asking me about volunteer opportunities previously, and after COVID, it kind of just, there weren't as many opportunities, and because we are a federally qualified call center, we have to operate under different regulations, you know, meaning that our volunteers have to be over 18 years old. And there's background checks that have. I don't see age.
We may not look like it, but we're all over the age of 18.
I just see a bunch of teenagers in this room.
Other ages.
Oh, we have a question right there.
Hi. The only question I have is, who does the maintenance in those buildings?
We do have a wonderful facilities team that has just expanded because we have 6 locations to take care of now, and you know, they help keep things running, and we love them.
Mary Grace, I have one more question, and that is about your partnerships and the other groups, organizations you work with. When I was on the Head Start board, you had a very strong relationship with Cape Head Start. Is that continuing, and do you get referrals for enrollment for the adults in the families of Head Start children?
Yeah, so Cape Head Start's actually at the top of my personal list of wanting to expand with. We do work with them, we've done events with them, and then we we do a dental day. But you know, it's one of I'd love to talk to you afterwards too, but it is one of the organizations that I do believe we need to work a little bit more with, yes. Okay.
This is to the audience. Some of you may remember the pandemic a few years ago, and there was no rodeo. Well, Access was, in fact, got this club's Community Service Award. For those of you who are too young to remember that.
Yeah. Thanks for that.
Thank you.
So one other item, just a little bit of context. So we were talking about twice the federal poverty line. And so essentially, if you're thinking of somebody who has no income, they're below the federal poverty line. They're noticeably below. So those are extremely poor folk. The people between the poverty line and 2 times the poverty line are usually working. They're usually working full-time. They sometimes have a spouse who's working part-time. So imagine a service worker, somebody working at Walmart, and a spouse who works part-time at Walmart or another service thing. They're below 2x of the federal poverty line. They don't have insurance except for Medi-Cal or Medicaid. So those programs, we're thinking of extreme poverty. That doesn't mean you're not working. That just means that you may be working full-time or even 1.5 times between 2 spouses in a household, but don't have full health care and full other services there. So the working poor, Livermore does have the largest collection of working poor in the entire Tri-Valley. So that is another thing to keep in mind, because some people have an idea that extreme poverty exists because people aren't working. And the answer is no, extreme poverty exists and people are working. And then we have people who are extremely poor because they can't work. And that's a separate category. It's the people who are working full-time who are kind of the tricky poverty, because occasionally they'll bounce up above the allowed income levels for the federal programs or the state programs. And that's where the creativity of Access, they really do bring to bear an enormous amount of resources to try and make sure that those people then don't fall through the cracks. It's a bummer to have gotten a 25 cents an hour raise and getting kicked out of stuff. And so it's like, wow, that sucks, because I don't make nearly enough to afford the $1,700 a month in medical insurance. My $8 a raise a month didn't pay for that. And so the tricky part is, and they do a great job on this, is figuring out all of those various programs and bringing to bear the great stuff. So the only thing more complicated than delivering fantastic medical care is all of the administrative stuff that those people can actually access that care. So well done on that.
Thank you so much for addressing that, because those people need to be seen.
Yeah.
So Mark?
Yes.
Can you remind us all what the federal poverty?
My recollection is the federal poverty level is below the 20% level here, so it's 19, 18. Do we have federal poverty level?
This is from last year for family of 4.
Yeah, so we
I
have.
couldn't see that, I'm sorry.
All right, yeah. So basically we have a 200% starts at 24,000, it goes to 48,000. And 100% is, those two. So my recollection is, it is adjusted by family size. So a family of 2 is a proportion of that. So you see there that basically you're at 24,000. So if you're doing the quick math, that's a $12 an hour job full time. If you were able to get, and if you work in any sort of industry where you're not able to get 8 hours a day every single day. So think the person who waits on you at any restaurant. Those are the folks that you're going to end up here. Your server, most likely, at any of your institutions downtown is going to meet the requirements for being under 200% of federal poverty, is going to spend 70% of their income on housing, another 30% on food, and it's like, whoops, we just ran out. So then they're basically getting some of the food supplies from our various kitchens here. They're getting medical support from Access. It's no fun to be in those categories. And it's not because people aren't working their butt off. It's because stuff just doesn't cover the cost to be here.
All right.
Other questions? All right. We're going to wrap up here. So, thank you. Don't go away here. I think in my box here, I have to look, so we're going to actually see what's in here. Oh my goodness. There is a bottle of red wine, a bottle of white wine, and a bottle of olive oil. Which of those 3 would you like? Bottle of red wine, bottle of white wine?
I'll take the bottle of olive oil.
Olive oil. Oh, wow. It's amazing olive oil from Olive Ranch. So thank you very much. Congratulations. And, here we go. We're going to stand over here and we're going to do a picture taken. So you have to make me look good because there's only one of us that looks good next time. Thank you. And finally, of course, because Access is a 501c3, and we are so proud of the work that we're doing, we're going to do on behalf of the club I'll give you a donation of $500 to access the FPV plane. So thank you.
And next week, we are back here in this wonderful place for Steve McCoy Thompson. And before we go anywhere, we have a ticket to read off. So,
Irv got a question first.
well, should we do Irv's question before or after the? Let's do Irv's question before. Irv, what can I help you with?
I'm speaking for the Rotarian Foundation, not the Rotary Club. And it turns out the Rotarian Foundation a few weeks ago received a check, a donation for $600. Very nice, except it personally came from JP Morgan Securities. But it has no other name and no other designation of what account it should go into.
So do we know anybody in the back of the room who has their hand up who that might have come from? Ah, we may have found the... Nicely done, Irv. That is sleuthing. All right, for those of you who bought a ticket.
The last four numbers, 5515.
5515. Right there. We have a winner. Yay. Okay, back here next week. Thank you all so very